So today we'll be running through one of our ARISE scenarios in simulation called Pediatric Pain Management. You'll be taking care of a girl named Paula C. Adams. And since we're using the ARISE scenarios, we're using iPads to augment reality along with QR codes. So part of your experience will be scanning QR codes for more information. We'll also be able to use our monitor to look through more information before we go in the room on the chart and get some basic information that way. You'll still be doing everything you normally do during a simulation, but now you'll be using the iPad for more information. Okay, so let's start by listening to a report like we normally would.
This is a report on Paula Adams. She's a 7-year-old female who presents to the ER with abdominal pain. According to her mom, Jane, who was in the room with her, they were in a car accident yesterday. She gave her Tylenol last night since her pain increased. This morning, she would not stop crying, so she brought her in. She has noticeable pattern bruising on her abdomen. Go do your assessment, and there are orders on the chart from Dr. Paulson.
Okay, so now that you've listened to report, is there anything that stuck out that you really want to pay attention to when you go into the room?
The bruising on the abdomen.
Okay, good. So she had some bruising on her abdomen.
The last time she got Tylenol.
Last time she got Tylenol, and did we catch what time it was?
They just said last night.
Last night. So we need to figure out an exact time, right, if we're going to give more medication. Anything else?
The complaints of aching, I want to figure out where that's coming from.
Good. So we want to do a real focused pain assessment, right, on the aching. Good. So now let's watch a video of the patient. And this is a little bit different with the ARISE scenarios. You're actually going to get a sneak peek of what the patient looks like and sounds like and what their concerns are.
I don't want to be here. Just want to go home.
Seeing that video, what do you notice? What's going on verbally, non-verbally? What kind of cues are you getting from her?
She's scared.
She just wants to not be here and feel better.
Good. Okay, so now I'm going to show you some of the EMR capabilities that the iPad has. So when you click continue, you'll go right to this patient profile screen, which gives you the basic information: her height, her weight, her admitting diagnosis, any medical history, her code status, and her allergies. So first we'll look at her H&P, which has her medical information from the provider. You can look at the orders for her current set of orders, and then you can look at the MAR. And on the MAR, there's hyperlinks to each medication that you can click on that'll give you more information about each medication. You just have to keep scrolling down, but it'll give you all the pharmacology and dosage information that way. So this will be available to you throughout the scenario. So now what I'll do is I'll let you guys look through it and pick out any information you want to know before you go into the room. So I'll give you about 5 minutes or so to read through that.
All right, ready?
Hi, Paula.
Good morning. We're going to be your nurses today. I'm Emma.
And I'm Dustin.
And this must be your mom over here.
Yeah,
Hi, Mom. How are you feeling?
my stomach hurts.
Let's see what Mom has to say.
We were in a car accident yesterday and somebody rear-ended us. Our car hit another car and the airbags went off. It was terrifying. And I thought she was okay, but she said she was achy and I gave her some Tylenol. Then she woke up this morning in so much pain. She says it really hurts to move, like somebody stabbed her in the stomach. You need to do something for her.
So Mom says that your pain feels like stabbing,
Yeah.
and it's just in your tummy, nowhere else?
No.
Okay, well, we're just going to do a quick assessment just to see how you're doing, okay?
Take a look at her belly.
Yeah. She's got some pretty significant bruising. Looks like the seatbelt got you pretty well.
Yeah.
I'm sorry. We'll get you something for that pain, okay?
All right, we're gonna
It
just.
won't be a shot.
We're just gonna step out. All right, we'll be right back. Okay. All right.
Okay.
Okay.
Okay, so let's pull up the MAR and see what we have available.
Well, the Tylenol was given at 4:30. Is it okay to give another dose yet?
It's only 7:30.
Okay. So I think we should probably go with the morphine.
I do too. So let's just see.
So what are some questions you have about giving a pediatric patient morphine?
First, probably the dosing.
Okay, so can you find any information about the dosage in there?
Yeah, right here.
Okay.
So, then we'll have to scan the patient.
Yes. We have what you need to make you feel better, okay?
Is it medicine?
Yep, but it's not a shot like you asked.
What is it?
It's just a little pill that you have to take. So it'll make you feel all better.
Can you tell me your last name, sweetie?
Yeah.
What is it?
Adam.
Thank you.
All right.
Okay. So we're giving morphine.
What do we have here?
Morphine, 15 milligrams.
All right. And this is morphine, 15 milligrams.
Yep.
So we have this little pill here for you, okay? So I'll put it in your mouth.
Okay, good. Now that you've had a chance to run through this scenario, we're going to just do some debriefing and review what occurred during the scenario and what we've learned from it. So let's just start with the basic reaction. How do you feel like it went?